Clavicle is the long bone. Like all other long bones, it has two ends and a shaft. It is the only bone that ossifies in membrane, and it is the only long bone that lies horizontally. It has a sternal end, also called as the medial end, called as the sternal end, and a lateral end, also called as the acromial end. The sternal end is quadrangular and it articulates with the clavicular notch of the manubrium sterni to form sternoclavicular joint. And the acromial end, it is articular and it articulates with the acromion process of scapula to form acromioclavicular joint. Okay. It also gives attachment to the fibrous capsule joint of the sternoclavicular joint and the articular disc and even interclavicular ligament. And the sternal end, acromial end, it also gives attachment to the capsule ligament of the joint. We talk about the shaft. It has medial 2/3 and lateral 1/3. Medial 2/3 is actually rounded. It has four surfaces: superior surface, inferior surface, anterior surface, posterior surface. Anterior surface is convex forwards and posterior surface is concave backwards. Superior surface in the medial end is rough and the inferior surface has an oval impression, and lateral to this is the subclavian groove. And lateral to the subclavian groove is the nutrient foramen. If we talk about the lateral 1/3, it is flattened and has two surfaces and two borders. Superior surface, which is subcutaneous throughout; inferior surface, which has a tubercle called as the coronoid tubercle and a ridge called trapezoid ridge. It has border. This is the anterior border, which is concave forwards, and the posterior border, which is convex backwards. If we talk about the muscular attachments, so on the lateral 1/3, on the anterior border arises the deltoid muscle, and on the posterior border of the lateral 1/3 inserts the trapezius muscle. If we talk about the medial 2/3, on the anterior border arises the pectoralis major muscle, on the posterior sternohyoid muscle, on the superior surface sternocleidomastoid muscle, and if we talk about the inferior surface, on the subclavian groove inserts the subclavius muscle. If we talk about the ligaments, so here attaches the coracoclavicular ligaments, the conoid part and the trapezoid part of the coracoclavicular ligament, and the costoclavicular ligament is attached to this oval impression. On the margins of the subclavian groove attaches the clavipectoral fascia. From the nutrient foramen passes the suprascapular artery. This is all about the clavicle.